you'll state your name, who you
Hello.
represent, your position on the measure.
Sure. I'm Dr. Laura Kuper. I am opposed to the legislation, and I'm representing myself. So I'm Dr. Laura Kuper. I'm a board-certified child and adolescent psychologist who has been providing mental health services almost exclusively to transgender youth and their families in Texas for the past 8 years. I am here today to share my professional expertise and speak in opposition to the bill. I work as a part of a multidisciplinary team that provides puberty suppression and hormone therapy to transgender youth, and I have personally provided assessments to youth who are seeking access to this treatment. I also oversee one of the largest and longest running longitudinal studies of transgender youth receiving hormone therapy in the United States, so we have that ongoing, and we have enrolled nearly 700 youth from our clinic. The oldest cohort of patients is now entering their 9th year of treatment. Results from our longitudinal study have confirmed what we see when we meet with our patients every day, that this treatment is safe, effective, and life-saving. Within our study, youth report large and sustained improvements in gender dysphoria, as well as broad improvements in depression, anxiety, and quality of life. We also have closely tracked the experiences of youth who stop treatment, and this data is consistent with numerous other studies showing that the experiences of regretting treatment are extremely rare. Contrary to the misperception that there has been an explosion of youth presenting for care, as the only program in our region, which is a quite large region, and we are known to be the largest provider, our yearly rate of new patients is 0.006% of the total population of minors in our region. When youth present for care, we follow an individualized and collaborative approach consistent with established best practice guidelines. There is a robust assessment process and informed consent process to ensure that both youth and their families parents fully understand treatment options and feel comfortable and confident about moving forward. We never assume what treatment, if any, is needed without first spending the time to get to know each individual youth and their family. We also inform youth that they can decide to stop or pause treatment at any point, and we will fully support them through that process. I can say with confidence that cutting off access to this vital care will be devastating for the hundreds of youth in our program. The distress, hopelessness, and panic youth and families are already expressing at this prospect is heartbreaking to witness. I'd like to end with quotes from 2 of our patients. I'm very thankful and lucky for this program. Y'all gave me the chance to live the rest of my life. This program changed my life, and I'm always going to be grateful for everyone involved in helping me transition. I wouldn't be here without you.
Your time's expired. Members, you have any questions for the witness? Representative Tinderholt.
Thank you, Madam Chair. Thank you for being here. Would it be how do you say your last name? Cooper?
Cooper.
Cooper, Dr. Cooper?
Yes.
Thank you for being here. If this bill passes, will you still do what you do and try to push people across state lines to get this care?
Well, I'm a mental health provider, so I will support them in the best way possible, but I also have to follow the law.
Well, if it's not put in this bill, it would not be against the law. So I'm asking, would you still do what you do and push them across state lines to get the care that you think that they need?
I would say that I have to act in accordance with my ethical guidelines from the American Psychological Association, so I would provide the same guidance and recommendations that I would otherwise.
So is the answer yes or no?
What the answer to which piece?
Whether you would still do what you do and then try to push them out of state to get the care that you think that they need, yes or no?
If it was illegal for me to do that, then I would not break the law, but otherwise I would follow the best practice guidelines and the ethics of my organizations.
So if this bill passes the way it is, it would not be illegal for you to do it. So would you push people across state lines to get the care? I think I'm looking for a yes or no.
Well, I'm concerned about this idea of pushing. I never push families in any direction.
So would you refer and try to assist them in going across state lines to get the assistance that you think that they need?
I would provide the same types of referrals as I do now.
Okay, so the answer is yes.
I'm not pushing anyone, but yes, I'm following standards of care.
Okay. Thank you, ma'am. Have a good night.
Other question, Representative Jones?
I didn't hear you use your own words and say push anybody across state lines. Is that accurate?
Yes, no, I talk to parents directly. I say, I never want you to feel pushed or pressured in any way. I'm here to support you through this process, and you're kind of at the center of that process along with your youth.
And so when you are consulting, counseling, I don't know what you call it, with your clients, or I'm sorry, with your patients and their parents, am I right to presume that you guys talk about everything and all the different alternatives that are out there for whatever their health care needs are?
Sure. So it's a multi-step process that's spread out over a number of months. When the vast majority of young people get to us, they've already been working with a therapist, and they see us for a minimum of 3 visits, which typically is about 7 to 8 hours at minimum.
And so would it be accurate to say you ain't pushing them nowhere?
No.
Like you come to some medical conclusion or whatever, I should say the parents, I guess, and their children come to something after they tell you what all their issues are, and you refer them where the standards of care suggest that you might.
Sure.
Right.
Yes, the standards of care do state collaboration is key to the practice. Yes, and I am concerned with folks that are sharing that they felt pushed or pressured into this treatment, because that is absolutely not consistent with standards of care.
Thank you. I appreciate that.
Sure.
Thank you for coming.
Representative Tinderholt?
Thank you, Madam Chair. Let me rephrase it. If this bill passes the way it is, it would not be illegal for you to do so. Would you consult and work with the family and the individual and refer them out of state for the care that you think they need?
Yes.
Thank you.
Other questions, members? Thank you. Chair calls Rachel Gonzalez.